I've just come in from physical therapy. I have been fortunate to be able to have somebody come to my house and make sure that I regain all the motion that I had in my leg before the surgery. I want to talk a bit about it. You'll see all kinds of ways to avoid having surgery, all kinds of supplements, etc., etc. And in talking to my surgeon, who is Dr. Levine with MedStar here in DC, he was telling me that we could grow collagen, but we can't get it to stick. So I want to encourage people who are waiting to have this knee surgery. Now, no kidding, it's not for sissies. It's really, really, really painful for the first little bit. And my daughter kept saying to me, Mom, this is much more than what you've been through. This is much, much more. So you need to be prepared for it. And she would say, I'm going to stay with you for 48 hours. And I would say, no, you don't have to do that. You know, I get some, nursing care or whatever. And she's like, I'm going to stay with you. And then 48 hours became 72. And then 72 became 2 weeks because they told me those first 2 weeks are crucial. And now I use this crutch. I use this crutch not in the way that House on the TV show uses it.
What's it mean?
He uses it on the opposite side of his body, which is not where he should use it. I have this cool green walker, and I have this ice machine, which looks like a cooler, and you just put iced water bottles in that cooler. And it is something you can strap onto your knee. You can see that photo here, and it will help you keep the swelling down. I had this very cool wedge pillow, and halfway through they said, we want you to keep your legs straight as possible, so that wedge pillow is encouraging you to keep it bent. So my little wedge pillow, which was helping me sleep at night, had to go by the wayside. I was experiencing some pain in my shins, and the skin around where the knee had been replaced, and it didn't seem like normal pain. Like it felt bruised, like the nerves were damaged somehow there. And he suggested that I use capsaicin. And capsaicin is peppers that you put specifically in the area where it is unusual pain.
This compound has the potential to block sensory nerve signals for pain and inflammation. So it's really good for pain from rheumatoid arthritis, pain from osteoarthritis, neuritis, which is inflammation of the nerve, neuropathy, which is nerve damage, even.
And it's supposed to, like pruning a tree or a bush or a plant, it's supposed to get rid of the damaged cells or nerve endings and, encourage the good ones in that way. It's like pruning my nerves or something. So I'm hopeful that is the effect, and I will let you know behind the curtain. IMO.